everyone, welcome back to another one of PIMG's free medical lecture videos for the Step 1. My name is Zoya Morani, and today we'll be discussing the disorder of sexual development in the reproductive section. Disorders of sexual development, or DSD, is also known as intersex conditions. These can be gonadal, phenotypical, and or chromosomal atypical development. As you know, normal chromosomes for the female are XX, and for the male, it is XY. You have two different types of disorders of sex development. The first type is either 46XY or 46XX DSD. These are also known as hermaphrodite or pseudohermaphrodite. So this is different than true hermaphroditism, which refers to a specific condition known as ovotesticular disorder of sex development. This condition is just one of many causes of 46XX and 46XY DSD. In true hermaphroditism, you have both male and female reproductive organs and tissues, whereas in female pseudohermaphroditism, you have male secondary characteristics but female gonads, and in male pseudohermaphroditism, you have female secondary characteristics but male gonads. Another type of DSD is known as sex chromosome DSD. So these are 45XO, which is known as Turner syndrome, 47XXY, known as Klinefelter syndrome, and lastly 47XYY, known as double Y syndrome. So the most common cause of 46XX DSD is congenital adrenal hyperplasia. This is where you have excessive or inappropriate levels of androgen steroids exposed during early gestation, which leads to congenital adrenal hyperplasia. This could also be caused by exogenous administration of androgens while pregnant. And some other causes are ovotesticular disorder of sex development, which I previously mentioned as true hermaphroditism. And lastly, it can also be caused by placental aromatase deficiency. Features of 46XX includes external genitalia, which can be ambiguous or virilized, and you have the ovaries present. So let's talk about the causes of 46XX DSD in a little more detail. The first one is congenital adrenal hyperplasia. Now this will be mentioned in another video in another section, but I do think that this is very high yield for your step 1, and so I wanted to go over it briefly here as well. These include 21 hydroxylase, 17 alpha hydroxylase, and 11 beta hydroxylase deficiency. These conditions are autosomal recessive. You need to know how to differentiate between the three, and I can give you a quick trick to remember the little details. So you would want to draw a little chart. You have hypertension on the left side and sex hormones on the right. Make a little table and you will write down 21, 17, 11, and all your ones are up arrows. So this basically tells you what symptoms you will find in each deficiency. So for example, in 17 alpha hydroxylase deficiency, the patient has increased blood pressure, but you will not see any issues with the sex hormones. And so you can just use this chart. It's a very simple trick, but it can get you points on question day. Secondly, we have the ovotesticular disorder of sexual development. This is where you have external genitalia which are ambiguous. It is one of the causes of 46XX, but can also cause 46XY DSD sometimes. In ovotesticular disorder of sexual development, you have both ovaries and testicles present, and this is also known as true hermaphroditism, which is no longer used to describe this disease. Lastly, you have placental aromatase deficiency. This is where you cannot synthesize androgens into estrogen. So serum levels of androstenedione and testosterone are elevated. You have ambiguous genitalia and female masculinization. Something interesting about placental aromatase deficiency is that the fetal androgens may cross the placenta into the mother and cause maternal virilization. Moving on to 46XY DSD, the most common cause is androgen insensitivity syndrome, also known as testicular feminization. You have external genitalia, which can be ambiguous or female, and testes are also present. Some of the causes, aside from androgen insensitivity syndrome, are Kallmann syndrome and 5-alpha reductase deficiency. Going into detail for the 46XY-DSD causes, let's begin with androgen insensitivity. This is where you have a normal appearing female with normal external female genitalia. However, you have a rudimentary vagina, which means it ends. There is nothing beyond that. Due to the persistent anti-Mullerian hormone from the testes, there is an absence of the uterus and the fallopian tubes. In Kallmann syndrome, you have incomplete puberty. So a mother may complain that her son looks younger than the peers and is less masculine. You have decreased or inability to smell. So this is called anosmia. And it is said this is due to migration of neuron being defective, and so the olfactory bulbs do not develop. This is an example of hypogonadotropic hypogonadism. You have decreased levels of GnRH, FSH, LH, testosterone, and this can cause amenorrhea in females and infertility in males due to low sperm counts. 5-alpha reductase deficiency, which is another cause of 46XY, is where you cannot convert dihydrotestosterone from testosterone. Genitalia are ambiguous until the testosterone increases during puberty and causes the external genitalia to mature. However, the internal genitalia have always been normal. Estrogen, testosterone, and LH levels are normal, but LH can also be increased sometimes, and you need to remember that this is the autosomal recessive disease. Sex chromosome DSD is when you have an extra sex chromosome or you're missing a sex chromosome. So this is usually caused by meiotic non-disjunction, which is the most common cause. And missing or having an extra sex chromosome is also known as aneuploidy. You have 3 different types known as Turner syndrome, Klinefelter syndrome, and double Y syndrome. As you can see in Turner syndrome, you're missing a sex chromosome, whereas in Klinefelter's and double Y syndrome, you have an extra chromosome. So here's a list of things in Turner syndrome that you would need to know. Again, these are females and they have increased LH and FSH due to decreased estrogen, so you do not have that feedback inhibition either. This can also happen in Y chromosome sometimes, so it's not necessarily just in females. And you have it either through mitosis or meiosis. So mitosis is loss of sex chromosome in some cells, and it happens after the zygote is formed, whereas meiosis errors are within the gametes, so the sperm of the father has missing sex chromosomes. An important feature of Turner syndrome to remember is streak ovaries. A few other things that I think are pretty high yield are the short stature, coarctation of aorta, and bicuspid aortic valve. They have a distinct webbed-necked feature. They have high arched palate. Horseshoe kidney is also pretty high yield to remember. To differentiate Turner syndrome from other ones, you need to know that there's no bar bodies present. And they can still have children via IVF or progesterone and estradiol 17 beta injections. Klinefelter syndrome is usually in males. They have an increased FSH due to decreased inhibin caused by dysgenesis of the seminiferous tubules. They also have increased estrogen due to abnormal latex cells, and this causes a decrease in their testosterone, which is what causes the increase in LH. Klinefelter syndrome patients will present with testicular atrophy, hypogonadism, and they are infertile, so they cannot have children. Their hair distribution is in a female pattern. They will present with gynecomastia, and they have something called eunuchoid body shape. So this is tall, long arms and legs, and they're lean. They're usually underweight. Developmental delay may also be present. And as opposed to Turner syndrome, they have inactivated X chromosomes, which are called the bar bodies. The last sex chromosome DSD cause we'll discuss is double Y syndrome. These are males with 47XYY, so they have an extra Y chromosome. They may present with severe acne. They may have autism spectrum disorder and learning disabilities. However, their fertility is normal. They're usually tall, and it's usually undiagnosed due to normal phenotypes. So you may not know that a male has double Y syndrome. This is the end of our video. I hope the points are very straightforward, and as they are high yield points, they should help you on exam day. This is one of my favorite quotes. Now it is established in the sciences that no knowledge is acquired save through the study of its causes and beginnings, if it has had causes and beginnings, nor completed except by knowledge of its accidents and accompanying essentials. So what this is trying to remind you is try to know the underlying knowledge behind all the concepts. Don't just memorize, know the essentials, know what the beginning is, and know what it causes. I would suggest starting with physiology, as that is a great foundation to get into the pathological diseases. Good luck everyone, and hope to see you for the next video.